Hi there, Mark Jabin here, Medical Director for the Haywood County Health Department, and let's talk about this pandemic. So I'm sure you've heard about the CDC guidance out this week for what those who have been fully vaccinated can now do. In today's video, a few important details to clarify what they really said. And please, share this with someone that you care about. So first, what does it mean to be fully vaccinated? Well, for Pfizer and Moderna, maximum benefit comes 2 weeks after the second dose. Nothing new there. For the J&J vaccine, the guidance from the CDC this week also says 2 weeks after a single dose. But you should know that in the trial, efficacy was around 70% after 14 days. That's really good. But the much publicized effect of 85% reduction in severe disease and 100% protection from hospitalization, well, that was only reported after 28 days. So I'm not sure why the CDC did not reference this, but the message is full benefit for J&J is after 4 weeks, not 2 weeks. So from the first dose of any of these, full benefit comes after 4 weeks for J&J, 5 weeks for Pfizer, 6 weeks for Moderna. The guidance for getting together with others is only valid after these times. And until then, current protective measures with distancing, face covering, limiting time of possible exposure, avoiding crowds, all of this remains. The sooner you and those you want to gather with can get vaccinated, though, the sooner you can begin to follow the new guidance. Once fully vaccinated, you can gather in small numbers with others who are fully vaccinated, but it also depends on what's happening in the community. So straight from the guidance, let me read. The risk of SARS-CoV-2 infection in fully vaccinated people cannot be completely eliminated in the setting of continued widespread community transmission of the virus. Vaccinated people could potentially still become infected and spread the virus to others. And let me quote also from a study by Galante et al. Complete relaxation of prevention measures prior to adequate vaccination coverage resulted in essentially no reductions in SARS-CoV-2 infections, further emphasizing that vaccines are part of the Swiss cheese overall approach needed to contain this virus. So right now, although our case rates are much lower, certainly than they were a month ago, thank goodness, they are not yet low. We are still not out of the widespread community transmission here. So, but if the trend continues, we may be quite soon. What the CDC is acting on to give this guidance is that the risk is so very much lower after vaccination as to make the benefit of getting together now more likely to be worth the risk. It doesn't mean there's no risk, it just means there's much less risk. The judgment we each make now is really no different than it has been all along. How much is the risk that you're taking, and is it worth it to you? The CDC also gave some examples, the most widely publicized being that of grandparents, fully vaccinated, gathering together with their kids and grandkids, even if unvaccinated, without any restrictions, as long as the unvaccinated family members are not at high risk. Otherwise, the restrictions remain because the risk to those unvaccinated is just too great. So what does high risk mean? Well, the list of high risk conditions is actually quite extensive, and we'll roll these through as I talk. I would point out that 75% of the U.S. population over the age of 20 is overweight. And it has been reported that 75% of hospitalizations with COVID have been in people who are overweight. As tempting as it is to jump on this new guidance, please be careful if you are in a high-risk category and are yet to be vaccinated, or if fully vaccinated and you contemplate getting together with someone who is not. We are getting closer and closer, just not quite close enough yet. So last, the guidance says, if you've been vaccinated and have a close contact exposure, within 6 feet, more than 15 minutes for someone who is positive without wearing masks, there is no need to quarantine unless you get sick. The CDC actually put this out a few weeks ago, but at that time there were 3 criteria that also had to be met. Number 1, you were at least 2 weeks past the second dose, so you had maximum benefit. Number 2, within 90 days of the last dose. And number 3, you had no symptoms. These criteria were not listed in the new guidance this week, so I called the CDC and I asked. The criteria remain. As for now, there is this 90-day window. After that, you would want to be careful about exposing yourself. As time goes on, perhaps this 90-day window may be extended. For now, that's the guidance. Even more reason to be careful around those not yet vaccinated, and even more reason for us all to choose vaccination. So be well, we are getting closer and closer to a time when we can all safely gather together, especially if we each do our part. So be careful, especially right now.